So earlier this week, my younger brother had to have meniscal surgery for a bucket handle tear of his left meniscus. And in this video, I want to talk about the mechanistic reasons of why that happened. So why was his body almost predisposed to having this specific injury? Well, first thing, he had the same surgery back in high school because of a similar mechanism of injury. And what happened with him was it was post-workout, and as he was standing up from this sort of position, he felt a tweak or a pop in his left knee, and that took away his ability to fully extend and straighten the knee. Now, the purpose of this video is to go into the mechanism of why that happened. And so I want to talk about this from a biomechanics standpoint. First of all, maybe you could say it's genetic, maybe you could say it's how he's built, how we have trained over time, but I have naturally higher arches there through my feet, which is a good thing overall, but his foot structure is relatively like this. So he's well on the outsides of his feet. He rests in a lot of supination of his feet. You can see supination is paired with opening up the knees. It's paired with tightness through here, through the IT bands, and then all the way up through the glute tissue. So already being in this position is putting stress or strain all the way through the lateral chain from the outside of the foot and ankle up through here to the backside of the glute. That same position is likely why he was having some low back pain when he was doing multiple repetitions of squats. What happens with this is when you're tight through the lateral chain, and so when you're really resting on the outside of your feet, like in this position, it turns the whole body into a relative external rotation. What that does when you have that much external rotation is it limits the pronation and the ability of the foot to move this way. So as he would squat, he would get here and then his body would tip forward towards the end range of motion because he was way outside. This sort of movement here. So his squat kind of looked like this position where he couldn't use the interior line to drop down into a squat like that. He was always out here. Tightness through supination created a lot of tension in the anterior tib, the extensors of the toes. It put him on the outside of his feet, which tightened the whole lateral chain. After a workout, because he's already tired, his tissues are tired, past medical history that sort of confirms some stress or weakness through the lateral side of the knee, then put too much stress and strain across the meniscus. If you could think about this on the flip side of it from a preventative standpoint, if we were working on his single joint ankle mobility, so looking at more soleus mobility to work in that half kneeling dorsiflexion, making sure that he can engage the inner line of the legs going through his adductors when he's squatting more, all of those things would have been really beneficial components to minimize the stress through the lateral chain as he goes to push up into that sort of movement. Because if I'm here, especially post-workout, and I'm really pushing up, that's going to be a ton of strain across the lateral chain of the body. I know we're talking about this kind of in a synergistic pattern of movement, but we always need to have balance, and we're always looking for some symmetry in the body so that the meniscus doesn't get overloaded. If we think about the structure and function of the meniscus, it does really well with up and down compression and loading, and it gets challenged with rotational kind of shearing movements of the knee. So because he was resting so laterally to begin with, that strong kind of lateral chain pull push-up movement from a cross-legged sit put too much stress and strain across the outer knee, which then resulted in that bucket handle tear. Take-home point would be, if we had more underlying symmetry within the body, then he would likely have not overloaded the outside of the knee, and then he could have prevented that injury.